Thank you all so much for joining. So, obviously what brings us together today is we're all going through this very, very uncertain period with COVID-19. We have, many of us are under some sort of social distancing directive from our state or local or territorial government. And others that aren't are certainly seeing that as a very, very likely possibility down the road. And so one of the things that we're all thinking about is continuity of operations. How do we keep doing the things that we do every day? How do we make that transition? So under the Resilient Children, Resilient Communities initiative, we had developed a training packet on continuity of operations planning for child-serving and community-based organizations. But this training is not exclusive. It's not limited to just those organizations. Really what this was all about, this goes back even further. We were doing some funding way back in the day under the Centers for Disease Control and Prevention's Public Health and Emergency Learning Center program, the PEARLS program. And that was geared towards public health trainings. And we found this notion that there are these smaller organizations based in communities that serve the community every day that really are what FEMA would later come to call lifelines of the community, right? Providing essential services, providing support for the community, and their ability to keep functioning affects the health of the whole community. The challenge is that while there's some great continuity of operations programs out there and certifications from groups like the Disaster Recovery Institute International and others, they tend to be geared towards specialists, towards professionals, folks who can dedicate a good portion of their time to business continuity planning. And I think everyone here should continue to look for those resources as they do have a lot of great information and great tips on business continuity planning and continuity of operations. But the reality is that a lot of small community-based organizations may only be made up of a couple of people, right? So having a full-time continuity professional is very difficult. So we developed this training really geared towards organizations in the community to help them, at least if you can't do the whole business continuity planning to the gold standard, where can you get started? What are the initial steps that you can take to make sure that you're better off and more likely to continue? Now, I know I have some colleagues here on the webinar as well, too, from the Earth Institute at Columbia University, because we were on some calls, and a lot of, while large organizations oftentimes have very significant enterprise continuity planning, here we are in various business units, and these units function almost like small organizations within the academic community. So I really do believe that a lot of the topics we're going to cover here are very generalizable. They're based on a larger understanding of business continuity. And they should help you get started in terms of doing your own business continuity planning, continuity of operations planning for whatever it is that you're doing out there. So very quickly, a little bit about us, the National Center for Disaster Preparedness. We're based at Columbia University's Earth Institute. And we're really based on these pillars of research, policy, and practice. In some cases, we're conducting primary research, but in all cases, we're really looking to take the best research that's out there and translate that into resources that are useful to today's problems. I guess that takes on certain urgency because usually I say that as a very abstract to today's problems, but today's problem very much is COVID-19 along with all of the other things that are still going on in the world. And so we accomplish this through trainings. We have a learning management system that's trained over 100,000 people in over 40 countries. Through information products, some of the social vulnerability mapping we've done to help identify vulnerability to oncoming hurricanes has been found to be very useful in the government and non-government humanitarian assistance community. Through policy and legislation, advocating, making sure that the community's voice is part of those conversations. As well as working with other donors, doing thought leadership with the private sector, and looking at conducting polls to find out what people think of preparedness. What are some of the approaches that we're taking, and how does that correspond with how people actually view preparedness within their own households? The Resilient Children, Resilient Communities initiative is funded by a grant from GSK. And it's really taking this understanding we've had after years of research. We've been very good at describing like children as the bellwethers of recovery, at being able to understand how children fit in with community and how all aspects of community impact a child's journey, trajectory after a disaster, and how the disaster is really imprinted on the children. But through support from GSK and the initial partnership with Save the Children, we really looked at, okay, we're good at talking about it. How can we change it? How can we engineer community resilience in a way that's inclusive of the community, that's informed by the evidence base, and that bubbles up so that national policy discussions have the community voice as part of that conversation. And so we're working with communities in phase one in Arkansas and New York, in Washington County, Arkansas, Putnam County, New York. We worked in the preparedness, the pre-disaster space. In this current phase, we're working with communities in New Hanover County, North Carolina, Robeson County, North Carolina, as well as communities throughout Puerto Rico, and in particular in Mayagüez and Humacao. To look at the role of resilience building in the aftermath of disaster. These really passionate members of the community looking to build back even stronger and incorporate resilience. And so that's really the idea here, is to create a model that is driven by the community, informed by evidence, and plugged into national policy leadership focused on resilience. And the idea being that, if you want recovery to begin, it has to start with safe children. And that's really, really the beginning if you want to get parents to work, if you want the economy to resume, if you want recovery to really achieve the goals across the community that it's seeking to achieve. Finally, about the initiative, but also bridging into the content today, we have the Resilient Children, Resilient Communities Toolbox. So this is a set of resources that are focused on for different communities, individuals and families, child-serving institutions, your community-wide planners and policymakers. These are tools we've either developed under the program or have been curated under the program, where members of the community who we've had the privilege to work with have said, this has been really helpful to us. So what we've done is we've taken those tools and we've put them in the RCRC toolbox. We've also had a Spanish language version launched this year, and most of the tools, certainly all the tools that we've developed, are now available in both English and in Spanish. So I encourage folks to go there for a variety of tools. All of the tools that we've developed are editable. You can download them, you can change them, you can put your logo on it. It's there for you, it's free. By all means, if it's helpful to you, use it. If you have tools you think would be helpful to the communities, let us know as well too. This is going to continue to grow, continue to be updated. This training package that we're going to talk about today is also in the toolbox. You can take it, you can take these slides, you can take these resources, make them your own, and it's available in English and in Spanish. The links are on the screen here. Jonathan's putting them in the chat as we speak, my producer extraordinaire here. Or you could just go to the RCRC toolbox and in the search bar just write COOP and it should pop up, no problem. As we go throughout the day here and we go through this training over the course of the next hour, hour and a half, go ahead and put your questions you may have along the way in the chat box as well. If you see me looking down every so often, I have a monitor here to take a look at these questions as they come in, and Jonathan's monitoring as well. And we'll try to answer them through the course of the training, and if not, then we have some time at the end to answer questions as well. And finally, one of the trends we see time and time again after disasters when it comes to really the work that you all do, right? The work in communities, is you see on the right, that sort of smaller red arrow, there's this gap between the routine needs of vulnerable populations and the routine capacity of the organizations that serve them. Nobody's sitting around saying, hey, we have all this excess capacity, right? Nobody's saying like, oh, we don't need that grant. We don't need these resources. Everybody's taken care of, right? There's already a distance, and that's the unfortunate truth, is there's a gap between the need and the capacity to serve that need. What happens after a disaster is that gap widens. Those who are on the tipping point become more vulnerable. Those who have access to resources see that vanish before their eyes. And then the ability to meet those needs, the organizations that serve people, that gets diminished as well. And of course, in COVID-19, we're already seeing that, right? Hourly workers, casual status workers, people who don't have sick leave but need to stay home when they're sick. We're seeing this across the country and being addressed in some actions being taken legislatively and things like that, but the reality is there are a lot of people that are made very, very vulnerable by the social distancing policies that are being implemented. At the same time, small businesses, human service organizations, they have a reduced capacity, right? Having people not being able to come into work, seeing diminished resources from revenue streams, things like that. So this is already happening right now. And so the main thing coming out of this day today is our goal is to keep that distance as narrow as possible. The more we can reduce that distance between the needs of people with vulnerabilities and as more as we can maintain the capacity of the work that you do every day, the more we close that gap and the less we have to rely on outside assistance that may or may not come to fill in that gap. So let's get into continuity of operations planning. What is COOP? It's not a philosophical question. It's got a pretty hard definition. Continuity of operations planning, so it really had its birth from a couple of different fields. On the government side, during the Cold War, looking at continuity of government, right? If there was a nuclear attack or something that really disrupted the ability of government to function, continuity of government planning came to be. In the financial sector, it came about, it really accelerated in the 80s and onward when you started seeing more and more financial transactions and transactions occurring reliant on the internet, on electricity, but essentially on electronic communications. This became a huge both advantage in terms of the volume of transactions that could occur, but it also became a huge vulnerability if that were to be disrupted. And so a lot of this has its origins in kind of those two places. And so again, part of why we developed this training is that those are large institutions, right? Large financial firms, banks, government institutions with a large capacity. And there are a lot of good trainings. FEMA has some good continuity of operations planning trainings. There are some in the private sector, as I mentioned, DRII among others. And so if you're really looking for gold standard, comprehensive training, that's where you want to go. We'll get you started today. We'll give you a couple of tasks that'll really take you a long way down this road. But you're not going to want to come out of this hour and a half webinar and then start positioning yourself as a world-class continuity of operations planner. But hopefully what you'll get out of this will help you to navigate the uncertainty we have in front of us with COVID-19 and really any disaster with a few more resources under your belt and a little bit easier to anticipate and manage disruptions. So in developing a continuity of operations plan, kind of the traditional buckets that we use are first and foremost staffing. You have the people that are part of your organization. Then you have the assets, the buildings, the vehicles, all of the physical property. IT systems are usually lumped into a separate bucket because they have so many very kind of specific and nuanced, both hardware and software and security considerations. And finally, vital records. We all have records for our organization, and even if you're not in a hypersensitive, record-heavy environment like healthcare, you still have information that would be needed, whether it's making a claim, whether it's helping to identify if someone in your care, a child who comes to your facility, is moving to another. There's still information that's very vital. And the idea behind this is by looking across the entire enterprise of your organization, and even if it's a small organization, and you may have less people than you do icons on the screen here, you still have all of these things. And that's a theme I'm going to come up to again and again. But the idea is to understand your organization's essential and non-essential services and what those essential functions depend on. And in doing that, you're in a much better position to make decisions about what to do, where your priorities are, and you're also much more empowered to ask for assistance in much more specific ways. You're not in a position to say, I don't know, we need everything. You can say, well, I need fuel for the cars to provide this service. Then all of a sudden it's very clear how a resource you're requesting affects an outcome. And again, your recovery is critical to the recovery of the community, whether you're in a physical community like a county, whether you're in an academic community like here at Columbia or elsewhere. So the U.S. Department of Education has also developed its own set of COOP functions. They've worked in close collaboration with the Federal Emergency Management Agency, among others. So schools tend to group their continuity of operations functions a little bit differently. They do it in terms of learning and care services, staff administration, transportation, organizational support, and communications. So these are all optimized around the way that schools do business. Really, it's fine either way. Use whichever organizing principle best fits what you're trying to do. It's really just a way of bucketing things to break them down and be able to manage them in more manageable pieces. So first and foremost is the orders of succession. And this is something especially in small organizations, we don't always think about. We kind of know who the boss is, right? We kind of know who signs the checks. But then everybody just kind of works together in a less formal way. And actually, in organization theory, that's how it is. That's how small organizations work best. You have some clearly delineated responsibilities, and you have others that you just don't require that level of bureaucracy because it's just not big enough to require that. But it is really important to look at who signs those legal documents, who can make those decisions, who can make the open and close decision, what to suspend, what not to suspend, what are in the bylaws with your board of trustees or your board of directors. This becomes really important because we all know who that one person is, but who's that second or third person if that one person is not available? So one of the first things you want to do is really look at the orders of succession. Is it written down? Are there certain things that only one person can do? Again, being part of a large institution like Columbia University, there are certain people who are allowed to sign contracts. I can bring it to them, but it's not for me to sign. Other people are empowered with that responsibility. Now, of course, going further on that example, if one of them is on vacation, if one of them is out sick and something needs to be signed by the end of the day, there's somebody else. There are backups that are identified. Those are the kinds of things to really map out orders of succession and to make sure you have clear. Even if day to day it's not as important, in times of an emergency it can become very, very important. And this is really, I think, the most important thing we're going to talk about today, and we're going to come back to it a few times from a few different angles, is essential and non-essential functions. So let's start out for a minute using a fast food restaurant example. So you have your critical and your non-critical functions here. And full disclosure, I have not run a fast food restaurant, so this is somewhat arbitrary. But again, it's just to illustrate the point. So if you're in the fast food business, food preparation and distribution is probably pretty critical, right? You can't sell the burgers if you don't make the burgers. Financial transactions, you can't sell the burgers if you can't get payment for the burgers, right? Otherwise, you're just giving them away. Sanitation is a regulatory requirement, probably pretty important even if it wasn't regulatory. Vendor support, you're getting stuff from the outside, right? You don't have a farm out back, you're not harvesting your own grain and making your own bread. So all of these things are critical functions that you can't open the doors without them being in place. Then you have your non-critical functions, and I'm going to come back in a minute because I acknowledge there's really no such thing as non-critical. But in this case, these are things that you can open your doors, you can do your business with if you don't have them in place. And in this case, the children's playground area, staff training and professional growth, guest services, birthday parties, things like that. All pretty important in the long-term life of this business, but the doors could open temporarily with those things not operational. You can move resources away from one into another. You hear in healthcare a lot, canceling elective surgeries, surgeries that can wait if you need to move those resources towards more critical life safety issues. And then along the bottom, dependencies, and this becomes really important too, because all of our critical functions, we don't have total control over the ability to do it. And in this case, electricity, and in this, if they have gas stoves in this, their gas provider, right? We all rely on things from the outside, and we need to know what those dependencies are. Great. But then, as I mentioned before, everything is really essential, right? It's not like we have a lot of excess stuff in our organizations. Organizations run very lean. I say that staff development was listed as non-critical in this prior slide, but actually, it's actually very, very important in the long term, right? Whether it's employee engagement, whether it is maintaining licensure, and just as a viable, growing organization, it's very, very important. So when we talk about that, we're really not talking about if what you do is important or not. We're talking about how long can we go without it before we have to have it. And that's where these recovery time objectives become very, very important. Because what you have with each of those is a prioritization based on time. Priority 1 are those functions that address immediate life safety issues, first and foremost. If it's a life safety issue, it has to be in place, right? If it's a regulatory or a required function, it needs to be there. A lot of government offices have statutory functions. By law, they're required to provide. One of the things you're seeing a lot right now with COVID-19 is you're hearing a lot about waivers of these requirements, extensions so that people don't have to submit things by a certain date. You'll see waivers to certain healthcare regulations to make it a little bit easier to move people between facilities. So that's an important thing to understand, because at times those things can be waived if you know what they are and you know what to ask for. And of course, finally, the revenue impact. A loss would lead to really an unacceptable loss of revenue. And I don't take that lightly. It's not, it's not just about making money. It's about keeping the business viable and keeping it afloat. A lot of these, whether it's a for-profit or a not-for-profit, if it's closed, it does not serve the community in any capacity. And so it's very important to keep our businesses viable. And then the priorities 2 and up are these functions that can go, and they're traditionally defined as priority 2, you can go about a day without, priority 3, about 3 days without, and priority 4, more than 3 days without. This is where a pandemic scenario starts to get tricky. A lot of these are based on kind of short-term disruptions, right? You have a hurricane, you have a tornado, you have an earthquake, you have some sort of relatively short-term disruptive event. The challenge with pandemics is most people are under a 14-day or longer social distancing policy. These disruptions may not be as total as shutting down. I know in New York, where we are, there's some capacity limitations. A lot of restaurants can only do takeout. They're still in business, but they're doing takeout. Other stores have their occupancy cut in half, where they can still be open, but they have to have half as many people in. So it creates a different dynamic in terms of a 72-hour recovery time objective in a 14-day window. Pretty much everything falls under that. So we're looking at kind of the same kinds of issues. What are the essential functions? But then we have to look at how do we manage that over a longer time horizon. I'll give another example. I know some of my colleagues from the Earth Institute doing research have some equipment that maybe the laboratory can be closed, but the equipment needs some routine maintenance every few days or every few weeks. So that would be one of these lower priority functions, but it does need to happen, and it does need to happen within the window of the social distancing policy. And so I know my colleagues there are working on strategies on how they can accomplish that while still respecting this spirit of the social distancing policy, where they can get in there and do that essential maintenance and maybe moving research out of there so they're not coming into contact with people unnecessarily. Again, all just examples on how this plays out, and we can give you the framework for how to make these decisions, but ultimately I think we're all just trying to make the best decisions we can with the best information available under very uncertain circumstances. So here's an example, going back to our fast food restaurant, of prioritization. So food preparation and distribution, financial transactions, sanitation, really needs to be, you really can't open without any of that. Vendor support we identified as a critical function. You can maybe go a day without that, maybe 2. Depends on how much storeroom you have in the back. In the city here, maybe not. Maybe in other areas where you have a larger stock room, maybe. I used to work in a large coffee chain, and there were times where we forgot to deliver something, or where we missed the delivery, and so, you put the medium in the larger cup, or you find another store nearby and share it. We could deal with it for a few days. We could not deal with it for a few weeks. And then, of course, the 3 days greater are those children's play area, staff training, professional growth, guest services. They can go for a while. At some point, especially with staff training and growth, what are the options for alternative ways of doing it? We know we have, so I would say in a pandemic scenario, for something like that, we know we have more time to figure it out. But because the length of time we're planning for is more than 72 hours, we do have to figure it out, right? And of course, we're doing a lot of remote work, a lot of remote meetings, and finding new ways to transition so that we can keep those things going that maybe we can live without for a few days, but we can't live without for a few weeks, to find viable alternative ways of delivering them. And then comes the question, so we have COOP plans. How is that different from an emergency response plan or an IT disaster recovery plan? We have all these plans. One of my favorite comics is a disaster planner saying, "We need a plan for the plan, for the planning, plan." And anyway, it's welcome to my world. But all of these plans are actually connected with each other. Kind of the beating heart of an organization, from an emergency planning perspective, is their emergency response plan. That talks about how the organization shifts in an emergency. If they have outward-facing responsibilities, so if you're out there in the field and actually responding to the emergency, it'll be included in that, but also internally, your crisis management, how you deal with that. That points to your continuity of operations plan. It points to your IT disaster recovery plan. It points to when it comes to continuity of operations, this will be carried out consistent with the continuity of operations plan. When I was writing plans as a planner, that was my favorite thing. I got to write in one sentence and make it somebody else's job. But those plans have to exist. We can't point to a plan that doesn't exist. So while the emergency response plan gives the overall view of how an organization responds externally and internally, the COOP plan goes deep into those continuity of operations. What are those essential functions? All of the decision-making behind that. Similarly, IT, the disaster recovery, where are the records kept? Where are the backups kept? What are the alternative systems for routing information if it's very information heavy? Again, a lot of you may be from business units that are a part of a larger whole for this. I know our IT disaster recovery plan, we have some responsibility in knowing where our stuff is, and some of it falls on the broader university. Other folks, it may be that there's 4 of you in your organization, and you don't have all of these things documented in 50-page binders that are sitting on the shelf, but you should at least have a concept on how these things work and know that all of these come together towards the greater whole and to facilitate disaster response and ultimately disaster recovery. So normally when we do this training in person, we stop and we take a break, and we have folks work in a small group. We don't have that luxury here, of course, but you can send over the chat if you have some thoughts on what are some of your organization's essential functions. If you send any through, I'll try to read them up here as well too. But by all means, and if you're watching the recording of this that's available after the webinar, you might want to pause here and actually pull this sheet, the Continuity of Operations Planning, one of the sheets that we have in the training package, and fill out a few of these. Take a look. What is your organization's mission? Starting from that, and then start looking at what are some of those things you do that are required in order to accomplish that mission. What are some key services you provide? For folks who have been chatting, if you don't mind sharing, throw 1 or 2 of them up there as an example in the chat window on the YouTube. And then for each of those, develop some recovery time objectives for them. How long can you go without them? And again, this cheat sheet here is really just to kind of help you through the questioning of this, to help you to identify how much, to kind of parse through how essential it is, what it's linked to. It's not necessary that you do one of these sheets for every single essential function, but it's designed as a job aid to help you through that process, to help you think through. So as we go forward, the next question is, okay, so we've talked about essential functions. We've talked about kind of the role of continuity of operations planning. How do I develop that? So in continuity of operations planning development, there are these following steps, and we're going to go through them one by one. And again, I want to emphasize different organizations are different sizes. Some of these committees, some of these processes may seem to you like, oh, there's no way we can do that. There's 3 of us, there's 5 of us, there's 15 of us. And we're 99% of our time, we're at 120% effort, working overtime every day. And certainly, I hear you and certainly applaud you for the important work you're doing. And what I say in that circumstance is you don't necessarily need to do these things down to the letter, but just understand what it is they're trying to get at. And I think the best example here is convening a steering committee. So in a large organization, you may have a steering committee and then an implementing committee and then working groups to work on all of these things. And we actually have this in the training package as well. I call it a COOP planning cheat sheet. It's got some tools here to help identify who should be on your steering committee, the steps along the way as well too. So in the training package, if you pull this off of the RCRC toolbox, you have access to all of these, and they're all should all be editable as well. So convening a steering committee. So what this means is that who does this plan affect in the organization? Well, everybody. Who has the resources and specific expertise within the organization? So you want to include all the relevant departments and leaders, some sort of central leadership, a director, an executive director, program manager. Human resources is important to have there. If you have food service, things, IT, the various divisions. If this were a large Fortune 500 company, you might have the senior vice presidents of the different operating divisions. You might have some of your administrative support, your IT, different groups like that. And then they would come together to really make sure that what you have is a 360 perspective of the organization. And then within the committee, you're assigning roles to the project manager, subject matter experts, approvers, and my personal favorite, the writer. Everyone's a planner, right? But who is that person who can actually open up the computer, open up the file, and clickety-clack start writing the plan? And again, coming back to, I may have just listed more people than your unit or your organization has. This isn't to say, well, you need all of these committees, but understand why larger organizations use them. If you're a smaller organization, this may all be the same person, but these are the different roles. You need to have project management. You want to make sure there's subject matter expertise. You need somebody to write, and you need all those different departments and divisions. An example I like to think of too, I used to work in a large healthcare system, and there was an example where I believe it was the laboratories had their essential functions, and one thing that they thought was not very essential in terms of the work that they did, a certain kind of testing. But then it turned out that in one of the other units, it may have been the emergency department or the OR or something like that, that diagnostic was actually very, very important and essential for their decision making. So there's an example there where you have two different groups with two different priorities, and then ultimately this steering committee and these work groups help to reconcile that, to help realize like, oh, we didn't realize that was so important for you, and vice versa. And so that's why having that central perspective to deconflict and make sure that they're all coming together and connecting for the whole organization. Again, it may not be that compartmented, it may not be that bureaucratic for your organization, but understand why the steering committee perspective is so important, and in however you organize yourselves, make sure that you're organizing all of those perspectives. Even if it's in the same people, having two different meetings or two different, say at this point we're going to look at it from the high level, we'll get into the detail next, or vice versa. And then what do you do in developing this? I mean, this is really committee management 101, documenting discussion points and the action items, identifying the milestones, coming into first drafts, and reviewing having review and comment period, giving everyone a chance to look at this, incorporating that into drafts, and ultimately getting to final drafts and final approval. So in this process, I can't tell you how many draft plans I've seen in my my career, as well as partially finished plans. And that's not always a bad thing either. It can be very difficult to completely finish a plan, but to have a framework in place, to have something that's actionable and documented, even if it's very rudimentary, I think is really, really important. I'm going to show you a couple of unsanctioned shortcuts, if you will, to get you in a place of greater action while you're working on the larger plan. Determine essential and non-essential functions. So this is actually good timing because we also have in the chat on an example of this. So in this organization, to provide volunteers to afternoons and mentors to at-risk youth. So I think that that's a very essential function. You have a lot of folks who are at risk, and making sure that they're getting mentorship, making sure that those volunteers are able to get to them. And if that doesn't happen, I think about that kind of service a lot right now, actually, with COVID-19, with the extended time frame that we're having these slowdowns. This isn't 72 hours where we don't have kids in school. This is 14 days, 21 days. a month, 2 months, that that we're potentially looking at. So these kinds of things, this kind of mentorship. Thank you for sharing that, because I think that it really does put a whole different spin on what we're looking at here. And again, even in these shorter disasters, important to maintain those things that we see. So as we've talked about quite a bit with determining essential functions, and we're going to talk about quite a bit more, is that each department, each unit, really identifies the function it provides internally and externally. If you're a larger or more complex organization, you can see how quickly this turns into a multi-year project to get into every unit and start inventorying these essential functions, meeting with folks, and then going back and forth to map them against each other and deconflict them. In smaller organizations and very, very small organizations, maybe, or in a single unit within an organization, this is a bit simpler, right? Which isn't to say it's simple, but it is a bit simpler. But again, the idea is to make sure in each of these areas, whether it's using the more traditional people, assets, IT, and vital records, or in the educational environment, the Department of Education's approach of the learning and care services, staff administration, transportation, organization support, and communication, sort of work within those buckets. And once you identify all of those functions, determine the impact of the loss of each function. What does it mean? This becomes, I think, really important to get into what are the consequences of not doing it. So I remember working, and again, this is on the health side, and it was with some colleagues hearing some stories after a Superstorm Sandy, where there were a lot of fuel shortages in the area, and it was the idea was providing directly observed treatment to tuberculosis patients. It's a process of ensuring that people are taking their antibiotics at the same time each day, because with tuberculosis, if you don't, you can pressure it into resistance, and it becomes a pretty significant public health problem if you have drug-resistant tuberculosis in the community. And so they had the staff, the outreach staff, they had the medication, and they had the vehicles, but they didn't have the fuel. So now all of a sudden you go from a place of saying, we don't have fuel, we can't do anything, to then being able to talk to your emergency management agency, talk to your elected officials, and say, if we don't have fuel, we can't deliver the medication to people, and then you're going to have the potential for a multi-drug resistant tuberculosis outbreak in the community. You become much more efficient, much more effective at advocating for what you need, in addition to being able to map out how you can alter your operations. And again, the recovery time objectives: at what time does this have an unacceptably negative impact on revenue? Does it make you non-compliant with a regulation, or does it affect the community in an unacceptable way? Can you go, how long can you go, using the example with volunteers and the mentors to at-risk youth? I would imagine probably not that long, and probably in a sustained period like this, where we're seeing weeks on end, that's probably one of those things where it increases the need and decreases the ability to do it. And so being able to maintain that, I hear you loud and clear that would absolutely be an essential function. And as I mentioned before, being able to advocate, being able to talk to your legislators and your elected officials who have the power to waive certain regulatory requirements, if indeed that's the only thing that keeps that as a priority one, and the spirit of that regulation can be accomplished otherwise. As I mentioned, there's a lot of heavy healthcare regulations that in times of an emergency, by relaxing them, can actually make the system more agile and more efficient and able to serve more people. And you're seeing examples of some of those waivers now. And again, this slide you've seen once before, and we just put it up here again because it's that important, coming up with what are those priorities and how to articulate those. So this is that workaround. This is that cheat sheet. I wish I could take full credit for this. A colleague of mine came up with this. We were working on a pandemic plan, actually. It was a statewide pandemic plan, and there's a requirement to have all of the continuity of operations plans from all the different agencies. And it was just way beyond the scope of the resources we had available to go to every single agency and every single entity within the state and review, and if they didn't have one in place, develop their continuity of operations plan. And so what she came up with was really this very, very brilliant approach, this spreadsheet where for each agency they would articulate their essential functions. And with each essential functions, what are those RTOs, those recovery time objectives? Who is it normally performed by? Are there backups identified in case they aren't identified? Is there a special credential? Would a pandemic increase or decrease the need for this? Are there standard operating procedures available? So throughout all of this, what this essentially became was a cheat sheet. If you didn't have a full continuity of operations plan in place, and I'm not saying you shouldn't do that, I absolutely encourage everyone to put a more formal plan in place, but in the interim, if you can inventory your essential functions, if you have this information at your fingertips, all of a sudden you know what your essential functions are, how long you can go without them, but also how hard it is to start doing them again. You can have an essential function you can go a week without, but it's got a highly specialized nuclear scientist, of which there's only 3 in the world, and if that person's not available, you probably got to start working on that today to be able to get that in place. I know when we're talking about childcare, there's a lot of licensures and things that we need to look at related to that. With a lot of the research that's going on in universities now, right? There's relationships with funders, there's guidelines from funding agencies. So there's a lot of different things that just because it's not an essential function on a 72-hour objective doesn't mean that you may need that 72 hours to start working on how you're going to either get a waiver or figure out a solution to transition that to an alternate way of doing things. So like I said, this is in that training package on the RCRC toolbox. You can download this and you can start using this as a roadmap for inventorying. Again, it is not a continuity of operations plan, but it is a good starting point for inventorying. And it came out of pandemic planning. So as we look at COVID-19, I think this asks a lot of the questions that are worth thinking about. At the same time, it's editable. Make it your own. You know, there may be columns you don't want, there may be new ones you want to add, and if you make alterations to it, feel free to send it our way too. We'd love to see how other people are operationalizing this. We don't have all the answers, we're just sharing where we're at in our journey along the way to get some answers. All right, we're still working on that COOP plan. We're developing mitigation and recovery strategies. So in this case, for each of these now, what can you do? You know, normally we teach this course in between disasters, so it's a little different now, but for staffing, how can you mitigate staffing issues? Cross-training, having folks who can fill in for other folks. If you have some doing functions that maybe are non-essential, we have a lot of front office staff now, right, that are no longer at the front office because we're working virtually. Can they do other things? Can they be trained to do other jobs? Memorandum of understandings with other organizations. If you're a child care facility, do you have an agreement? If somebody's out, can you swap staff? Something like that. Outside contractors, staffing support, temp agencies, things like that. And of course, working remotely. Or we see a lot of times too, lodging, where if there are disasters in the Northeast here, we get a lot of ice storms, winter storms. Are people able to stay overnight if they can't get home? Assets, alternative locations. If you can't do it here, is there somewhere else that you can do it? Could be remote work. It could be alternate space. If you have specialized laboratory equipment and you can't do it in your lab, is there another lab that can do it? Memorandums of understanding, backup generators. If you lose power, if a power is a dependency you rely on, which most people do, are there backup generators? Are there battery packs? What are the alternatives? Extra assets, supplies, food, things like that. IT, if the system goes down, if you can't submit a timesheet electronically, is there a manual process? Are there backup servers if it goes down? Extra equipment. Sometimes outside services can come in and provide some additional bandwidth. I know a lot of us are using various virtual meeting platforms now. I imagine so we're outsourcing a lot of that meeting time to outside services, but I imagine that those services are also reaching out to increase their bandwidth and increase their server load as well too. And then vital records, backups, physical copies, electronic copies, things like that. Whenever we teach this course too, there's always some great arguments about whether you should be all electronic or all physical, and I have stories on both sides where it was the backup electronic copies that saved the day, and others where the servers got flooded and the manual copies saved the day. So it turns out you don't need one or the other, you need both. So we've talked very generally. The next is to identify the threats and the prioritization. So you have your broader mitigation strategies, but then what do you look at first? Again, this is somewhat unnecessary at this point. COVID-19 is the one that we're all looking at. But as you're looking at this, we live in a world of many, many more threats than just COVID-19. That's the one we're looking at today, and obviously brings its own dynamics. But then in this, identifying threats and hazards that affect your organization and your surrounding community. A good place to start for this, most of your emergency management agencies have a hazard mitigation plan. They list the different kinds of hazards that you could face. The kinds of winter storms we face in the Northeast, you don't really have many of those in the Southwest. But you do have extreme heat. You do have other challenges. And through this, I always like to think in the hospital system I worked for, one of the hospitals, the community was vulnerable to coastal flooding from a storm surge, from a major hurricane or something like that. But the hospital itself was on top of a hill. So another hospital in town may have been in the floodplain and worried about water coming into the facility. This hospital had to worry about becoming an island. It wasn't worried about flooding so much as not being able to come or go because it was surrounded by water. So again, these are examples of where your community hazard mitigation plans will give you a sense of what hazards are most likely in your community, but only you can really know the dynamics that you work within, both physically and socially. And I think as we look at COVID-19, we see that as well too. It's not so much as a physical disaster, although there are clinical and biological components to it, but it's also creating a lot of social pressures and areas where people are already vulnerable and reliant on the services that you provide every day. I'm sure you're already seeing some of the strain of those pressures of lack of movement, of a lot of the things that are normally open not being open. And so going through this process and really finding ways on how can those missions be accomplished while still ultimately trying to maintain the goals of social distancing. Okay, and finally, finalizing and approving the plan. I do think that it's something that's important to get plans that are approved and signed off by leadership. Because it does, there's something to that, and we'll talk in a minute why that's not the end of what we're doing, but each department lead really should approve the RTOs, the recovery strategies, the mitigation strategies. What I find a lot of times is when plans are a working draft or they're kind of waiting to be approved is that they've been developed, they're 90% of the way there, but there's some conflict that never got resolved. The problem with that is that if that never gets resolved, and the disaster happens, it has not been resolved. And now you're dealing with it while you're dealing with the emergency situation. Having the engagement of leadership, having the sign-off is all very, very important. Once those departments have signed off, once your steering committee, and again, if you're a small organization, again, just understanding that people who look at the organization differently have had a chance to look at it and weigh in on it, you finalize it. And then you want to start training and exercising that plan. So again, here's one where we would normally stop and do an activity. Same thing for each of your identified essential functions and recovery time objectives. What are some recovery and mitigation strategies? For each of these essential functions, how are you going to protect those? If you're watching the recording of this, now's a good time to pause it. Take a few minutes, take a look at those essential functions you already looked at, and talk about how you might mitigate some of those strategies. And what are the pros and cons for each of those strategies? This is something we're looking at now, right? You stop going into a community doing visits. The pro to that is you reduce the likelihood of exposure to COVID-19. The con, you don't have those personal interactions. You're not able to see for yourself. A colleague, a friend of mine, is a real estate attorney and looking at can you do virtual notarization. And looking at the pros and cons. The pros being you don't have to be in the same room to do it. The cons being it's a lot harder to tell if someone is being manipulated or coerced. And so they're sort of parsing through some of that. I know I'm using a lot of examples that are sort of around what you do every day. And that's why I hope in the chat box and as we get into the conversation, I encourage you to have these conversations with other folks in your community and across the communities who do what you do so you can share examples with each other. I know when I was a planner in local health, the best thing for me was to always talk to someone else in local health and find out what they were going through, how they were approaching this. Even if I didn't do it exactly the way they did, at least I was getting examples that were similar to the experience that I was having. So finally, what do I do after the COOP plan? You got it done. What do? We put it on the shelf, we go out for pizza, or I guess we order in now because we're social distancing, and then we move on to the next thing. Of course not, right? Planning is a cycle. It's not a destination. The threat landscape is constantly evolving. So we need to maintain our plans according to that. The technologies are evolving. I was doing pandemic planning 10 years ago, and the opportunities to maintain operations in social distancing like this, like we're seeing for COVID-19, some of them were online, but not nearly to the extent that we're seeing them now. There are a lot of things in place that are making this much more doable than it would have been, both technologically as well as organizational support for the technology, comfort with the technology. And again, that's not to say everything is being done perfectly or well or smoothly, but it's just an example on how new technologies create new ways of doing things, changes in the organizational culture, things like that. And so your plan needs to evolve along with that. You need to test it and train it. If nobody knows about it, they're not going to be very good at implementing it. A plan, to me, is really a documentation of a thought process, but it's in the training and the testing and the exercising that really it becomes part of the DNA, the fabric of the organization. And you don't need the written word as much because everybody knows it and knows sort of where to reference it. You respond to incidents, and every time, whether you're training or testing the plan or you're responding and you're actually activating it, never let a good disaster go to waste, is what we say in the business. You always want that data. You always want to evaluate and improve. You want to capture what went well. You want to celebrate what went well, but you also want to capture what didn't go well and work to correct that into the future. For the plan maintenance, you usually want to assign personnel to it. You want to have someone where that's their job, right? For that every couple of months that they're taking a look at this. What is that maintenance schedule? Normally plans like this, they get looked at every year. That you want to update them no less frequently than every other year. You want to look at it more frequently than that. Sometimes the changes may be small, just a couple of new things. Sometimes they may be very big. If your organization gets absorbed into another, or you take on or open up a new facility, obviously there's going to be some significant changes to the plan in that respect. And again, who needs to sign off on the revisions? You'll want to, at the minimum, inform the steering committee, keep them in the loop. But what is that revision process and engagement process going forward? And again, this is all about making it continuity of operations planning, not just a product that comes out of your organization, but make it part of the DNA on how you do business, so that you can implement it under a wide range of circumstances. Training and exercise program. So again, in large organizations, this may be a specialized position. You may have someone dedicated to exercises, dedicated to training. Otherwise, this may be a smaller part of it. I've seen this done where it's presented as part of, if you have monthly in-service hours, maybe this becomes one of the topics you focus on. I've seen organizations that do a quick scenario-based discussion at the end of every meeting they have on what they would do. What are the opportunities to implement training and exercises on this? Do you do large trainings, large exercises that are dedicated to this, or do you do it in smaller steps along the way? The best case scenario is a mix of both, but the reality is I think as long as you're doing something fairly regularly on this to keep it alive, to keep the thinking of this alive and keep people asking questions, then there's less that has to be figured out when it needs to be implemented. And after every exercise, as I mentioned before, after every real-world event, even if it's a small event, do what we call in the business a hot wash. Really just to review what went well, what went wrong, document those. Again, there's formal after-action processes that can be followed, and there's documentation out there on how to do it. Even a memo or an email afterwards recognizing this and assigning action steps, though, I think achieves the aim of these more rigorous after-action processes. So again, scale this to the level that makes sense for your organization, but understand why it's important. And then the mitigation strategies. So these mitigation strategies, some of these may be near term. Copy files onto a secure secondary server. Make sure that key staff have, a lot of us were looking at the license limitations on our meeting software. So that we had some projects needed full licenses, some could use individual licenses. We needed to evaluate that and increase or decrease the licensure. That was a very quick thing. We did it in, I don't know, a couple of hours and worked with the university. Other things, if we need to, buy a server, buy a generator, that may, or make a capital improvement, that could take years. That may have to be something that gets put into budget cycles that move much, much more slowly. So again, part of this is that, it's not all going to happen overnight, and that's okay. What are the things that are achievable now, and what are the things that if you never bring it up, it's never going to happen. If you never try to get it in your capital budgets, it's never going to happen. So that's the thing, is that to accomplish what can be accomplished in the near term and keep on the radar those things and those processes for implementing these mitigation strategies in the long term. Memorandums of understanding are another one. If you're working with another organization, a lot of times it's a non-binding legal document, but you wouldn't know it by the way that they're negotiated, because legal teams will look at them with the full effect of a legal agreement. But that's really, I think, a good thing. A lot of these complex legal decisions, liability decisions, things like that, there's kind of an assumption that they just go away in a disaster. Sometimes they do, but sometimes they don't. And then you have to spend your time responding and working out who's going to pay for what, who's going to be liable for what if you're using somebody else's equipment or using somebody else's facility. Where we are today, COVID-19, this is a very slow-moving disaster. It seems lightning fast, right? The social distancing was implemented very, very quickly. But the reality is that we're probably going to be looking at this and adapting to this for at least several weeks, possibly several months and longer, depending on how. And those external relationships are critical. The public sector, most assistance that comes through emergency management structures. So your local emergency management working through the state, which is the pathway for the federal assistance to come through. So those relationships are absolutely critical, as well as the utilities. As you go through your essential functions and identify as you identify those essential functions. I'm seeing that I lost audio. Can other folks hear me okay? I'm getting a note. I'm wondering if it's a one-off thing or not. Can folks ping me on the chat if you can hear me? Give it a minute to come through. We're okay? You guys can hear me? Okay, great. I'm going to keep going. Thank you for bearing with us. All right, so these external relationships, so utilities for those dependencies. Okay, great. Looks like it's coming. I'm seeing the chat come through now. Thanks everyone for letting us know it's coming through. Communications, telephone, internet. We're talking about remote work now, so access to internet is pretty important, right? What are some of the redundancies for that as well too? And then are there other similar organizations? A lot of times folks will set up memorandums of understanding with other organizations. It's sometimes if you're a unit within a large complex organization, like Columbia University, you may have, want to work across schools. You might as well be different organizations. So sometimes you even have MOUs across that just to help hash all these things out. And then for philanthropy, for donations and grants, I know a lot of these key community human service organizations are very dependent on philanthropy. And so establishing those relationships are obviously a good thing on a lot of reasons. So in conclusion, let's take a few minutes here for any questions that folks may have, any clarifications, and I'm also happy to chat about any barriers you may be facing in creating your own continuity of operations plan. As I give folks a minute to type some of those in, if you have questions, what I would say is, again, I keep coming back to essential functions because that's the starting point. Knowing what's essential, knowing what you need, knowing how you can move things around, just that inventory is so powerful in and of itself that's why there's so much focus on this. And again, as folks are looking and you want to get more robust into this planning, there are programs there through FEMA as well as through other organizations. Some are free, some are paid. It's a paid process to get to a certification, but there are a lot out there as well. The other resource I didn't mention in the training package is there's actually a continuity of operations planning template. Probably should have led with that one, that there's a template. You can go into the training package and you don't have to start with a blank sheet of paper to write a full continuity of operations plan. You can steal ours and you can edit it and you can do whatever you want with it. If it's helpful to you, by all means, take it, edit it, share it. We hope that it's helpful to you. So with that, I'll give just a minute to see if any questions come through over the chat. Take a sip of water in the meantime. There's a little lag on my end, Jonathan. I don't know if you're seeing any.
Nothing yet.
Okay, great. We'll give just another minute in case folks have some questions. We do have plenty of time left, so if folks do have questions, we can definitely engage in this. I'll keep an eye on the chat here, but I'll come to the last slide. So again, rcrctoolbox.org, just type COOP. I see one coming through. If you can rewrite, Jonathan, the one you mentioned, if you can type for me, I lost that one. But I do see a question coming through. So I work for a tiny organization focused on young people and teachers. We are worried about how to continue being helpful when schools are canceled. I think that that's a really, really important question, and I appreciate that very much because we're talking about these measures being put into place for epidemiological reasons, for biological and clinical reasons, but they have very profound social impacts. I don't know the full extent to which your organization is your day-to-day outreach and what you're doing when schools are canceled. I know we've even been looking at, internal to our own organization here, how do we keep the social bonds connected? And I think if the goal of that is to have outreach, to have a voice, to have a place for students and families to go, is to try to find some safe virtual forums for that. Is it a chat room that can be opened up to have folks come in and just talk about what's going on? Is it a phone call? Is it, and you can still be in physical proximity with folks. You just want to leave a little bit of distance from each other for that. Can you go and go to the park and sit 6 feet away from each other and have a conversation and have a chat? So if the essential function is that outreach, if that essential function is that contact with folks to talk through things and do that, I think that's where really sort of finding alternative means of having that context. I like to say that just because we're social distancing doesn't mean that we can't be social. And in fact, that some of these social bonds, the social cohesion, in a variety of disasters, it's been measured in a number of different disasters, but our connectedness to each other is actually one of the strongest determinants of health and mental health outcomes. The more we stay connected to each other, the more the less likely we are to suffer from those long-term health and mental health outcomes when we're looking out for each other. So I would say that absolutely we should be looking for ways to stay connected, and these outreach that may seem as non-essential from a traditional continuity of operations perspective may actually be even more essential during these prolonged situations. There was another question on COOP and how does it apply in a lockdown scenario. I'm going to put quotes around lockdown a little bit here too, because we are seeing varying degrees of social distancing. I'm assuming in this lockdown scenario, we're looking at like the Bay Area right now with much more aggressive social distancing. And I would say that it does, that, you know, it defines essential services, the shelter-in-place order. It defines, and we're seeing this in Puerto Rico and Italy and other parts of the country and the world as well, that, you know, there are essential functions that are allowed to continue under these public health orders. And being able to articulate these essential functions and why they're essential, what benefit they have to the community, and how they can be done in a way that's meets the scope and the intent of the public health protection order is something. Now, don't go out there and do something that's in conflict with the public health order and say, well, Jeff from Columbia said it was okay, but it puts you in a position to engage your leadership on that conversation, to be able to say to them, this outreach is essential for this reason, it has this impact, this is what we need in order to do it, and this is how we can deploy it with respect to that order. So I would say absolutely, to the extent that it can be. And I would also say that these aggressive kind of social distancing policies, these shelter-in-place orders, these quote-unquote lockdown type scenarios are also a disruptive event, and you can't just shut down. FEMA has statistics after disasters. 90% of smaller size businesses that don't reopen within 5 days fail within the first year after a disaster. So it's not just about you know, making that money. It's about staying in business. It's about staying viable in your community's economy and staying viable in the services you provide to the community every day. So really, I think important questions and very emblematic of the situation we're in now. The other thing too is that, you know, I was talking with a colleague, and with COVID-19, with the pandemic style of continuity of operations planning, it's funny, like, people assume I don't have any time given the nature of what we do. And what I tell folks is that it's not that I don't have time, it's just that I don't know when the time I have will be. So it's a lot of calls, a lot of things like that, a lot of kind of emergent things, but I do have time to do things. And I think that if your experience is anything like mine, and it may not be, that there probably is some time where you're at home in front of a computer, where there's some downtime. I know one of the things we've been doing here at the National Center for Disaster Preparedness for our own internal policies is we're using an online resource, kind of a wiki tool, which is really just a way of sort of categorizing our policies and procedures. Everything from how do you set up a web chat, a web-based meeting, how do you use the conference line, how do you file for reimbursement, to start documenting a lot of these procedures. I'm going to come back to that spreadsheet briefly. One of the things that's kind of tough to read, but I didn't realize it was that far back. Okay, is there a standard operating procedure in place? The reason that that's there is if somebody needs to do what that essential function is, if there's a standard operating procedure, it's a lot easier to do. It's a lot faster to do if you have a how-to guide, if you have a step-by-step how-to guide. So I would say, too, that as the world slows down a little bit in the COVID-19 response with the social distancing, to also use it as an opportunity to start building those assets, building those standard operating procedures, those things that you can provide to your staff, that you can have in a central location, so as they have questions, it doesn't require a lengthy one-on-one transaction, but most people can get started with a standard operating procedure. And I'm happy to talk offline a little bit about our experience with some online tools for that. We use a couple of different online tools. There's a lot of them out there. I don't want to promote one over another. Okay, I'm going to go back to the end one here. I'm a small one. Do I really need a coupon? Yeah, so the question is, I'm a very small organization, 1 or 2 people. Do I really need a COOP plan? And is that really different from the emergency response plan? I think my answer to that is sort of and sort of. So yeah, if you're a small organization, you know, I mean, what is a COOP plan, right? I can send you the FEMA template for government agencies for continuity of government. That's obviously not something that you need, right? But there probably are some things you do every day. when you process payroll, when you go to the bank, what functions you do every day. And so having that written down somewhere, having a procedure in place probably would be very useful. Will that be dramatically different from your emergency response plan? I guess it depends on what you do. I don't know the details of your organization. If you're, providing outreach to folks, it may not be that different. It may be a little different. But again, at the end of the day, I think if you're putting down your essential functions and keeping in mind how that might change, would you be taking on new responsibilities in a disaster? Then you might have a separate emergency response protocols. But if you're really just trying to maintain what you normally do, maybe you wouldn't have two separate plans. And maybe plan is a strong word. Maybe it's a couple of documents with some procedures of what you do. So again, I think that there's the gold standard, and then there's making it fit within the context of what you do. And I think as long as you're really making sure that you have those cheat sheets, you have that information available on how to respond, how to have those checklists on how to do those essential things that you do so that they can be done very quickly and you have something to ground yourself in. I think there's a good book, The Checklist Manifesto, and it talks about how, pilots, a lot of times how airlines work very, very complex machinery, very, very complex things, and they have these checklists for all these different scenarios. And one is for, at least according to the book, an engine failure. And they say number one on the checklist for an engine failure is fly the plane. Because what happens is pilots end up troubleshooting everything else, and they get distracted by everything else they're supposed to do, looking at this and that, and looking at these systems and that. And actually you have to step back and first keep the plane level. That's the first step. Fly the plane. Then you can start troubleshooting and doing those things. I think about that too with smaller organizations, that's really the one of the most valuable things you can do is to give yourself those reminders. Write down those things that you do without thinking. So when a disaster strikes, when you have a lot of different things to think about, you don't need to use unnecessary brain power and unnecessary time on those things that you can already have written down, and you can ground yourself in that and use that to help clear the noise and focus on what it is you're trying to do. I hope that there was an answer to your question somewhere in all those words I just said. So finally, I think we're getting close to the end of time. We do have time for questions if others come in. On the screen here too, so you see on the left the additional resources, and then on the other side some COVID-19 resources. I put these up here because the CDC really has, there's a lot of uncertainty around this. There's a lot of information out there flying in a lot of different directions. The CDC is the best source of the most recent scientific information on the virus. Social media is not the best resource for the latest information on the virus. Memes on the internet may be hilarious at times, but are not good sources of information for what's going on. So I put that up there, but also what they've been building out are guidance for schools and childcare, for businesses and employers, for community and faith-based leaders. Take a look at that. A lot of that stuff coming out is pretty good, and check back regularly. There are other government sources as well too, but this one, this is one of my favorite resources right now because it's being updated regularly. It's being retooled regularly to make it easier and easier to work with. The other, check with your state and local government, your public health, emergency management, if you're an educator, the Department of Education. All of the things happening nationally are from a national perspective, but everything we're experiencing locally, and it's very different. Decisions in New York City are different than they are in Binghamton, New York, right? They are different localities with different local conditions and different local requirements. So those, look nationally for the science, look locally for what it means within the local context. And finally, I would say, reaching out through us we have a LinkedIn group, the Peer Assistance Network for the Resilient Children, Resilient Communities Initiative. Reach out to us if you're interested in joining that as well too. But wherever you can, I think really seeking those connections with other folks, with your peers, doing similar work to what you're doing. I know as a planner, the most important thing for me was always, when I was a local health planner, was to talk to another local health planner. We experienced a lot of the same things. We were looking for a lot of the same resources, and it can seem very lonely when you're doing it on your own, but then suddenly to be connected with other folks that are facing the same problems, it can become very motivating and very helpful to share different approaches that are being done elsewhere. We'll continue to do our part here to bring you information. We'll continue to create resources and provide them on the RCRC toolbox. And you can also come to our website, ncdp.columbia.edu, where we're also doing other work and other media appearances and other information support as it relates to COVID-19, among with a lot of other great groups here at the Earth Institute at Columbia University and throughout academia. With that, I don't see any other questions here. So I want to thank you all again for your time today. I want to thank you for all that you do every day and all that you're doing now as we walk down this uncertain path together. I do know that while we don't know exactly what's going to happen next, that in working together, that in working towards those that we serve every day within the community and really putting children at the center of our strategies, that we are going to come through this on the other side with these lessons learned to make us more resilient into the future. So once again, thank you and thank you. Am I off?